Nearly 2 in 10 women experience mental health problems during pregnancy or after the birth of their baby. In a few rare cases, mothers become seriously ill and need urgent medical attention to protect both themselves and their baby from harm. In this film, we'll meet 2 women who experienced severe postnatal depression and have taken the courageous step of sharing their stories.
I cried initially, but when I was really ill, I didn't cry at all, because there's no point in anything.
I will never like what happened, but then I think I've come to terms with it and accepted it, and kind of you have to move on.
We'll discover how, with support from their families and health professionals, they continued to care for their babies as they received treatment and began their journey to recovery.
If you had a broken leg, you'd be quite open and talking about it quite easily. But with depression, people often feel frightened or ashamed to talk about it.
Katie has 2 sons, now aged 10 and 5. But back when her first baby was born, life was very different. Katie suffered from severe mental health problems after the birth. It began with a feeling that she was struggling to cope with her new baby.
All of a sudden, I just knew I couldn't cope. It was the crying, constant crying again. I ended up going up my mum's every day for a while, but it'd be when I get home, the problem would still be there. And over a period of, I'd say probably about 3 months again, I then just completely broke. By the time he was about 6 months old, I think it was, I was then an absolute wreck.
Like many mothers, Katie tried to hide the problem and didn't seek any professional help. When her baby was about 6 months old, she reached a desperate point.
My partner at the time went out and I said that I'm not coping, baby's crying. And he'd gone to the shop, so he hadn't gone far, luckily. And I took the overdose. He called the ambulance, and the hospital then wouldn't release me, so I discharged myself. I then actually just completely lost it, started smashing stuff up. Without realising, picking up a hot kettle full of water and chucking it. And that actually was quite close to my baby at the time. And I've done all this without even thinking twice what I was doing. And I think that was the turning point then, as if to say, no, I need help. I couldn't pretend no more, I couldn't put that front up because it wasn't working.
It's very important that you seek help when you first start to notice that something isn't right. Recognising when you're not feeling yourself and asking for help early could prevent a mild mental health condition developing into a severe one.
If mothers are starting to find that they're not enjoying their time with their baby, or they're having sleepless nights, or they're having symptoms where they don't feel their usual self, so they are feeling as though they're quite low in their mood, the best thing would be to seek help, and to seek help early. So that would be to see their GP, or usually, if it's in the postnatal period, speak with the midwife as well, and also they could let the health visitor know. But for whatever time, it doesn't matter what time of day it is, if they feel that the symptoms are so bad that they're not able to cope, they can also go to A&E and be seen there for help and assistance.
There it is.
Getting the right support can sometimes take a bit of time. Gemma felt she was getting depressed soon after her baby daughter was born.
Certainly I probably looked like I was doing quite well to some people. I knew I had postnatal depression and I went to tell the GP that that's what I knew. And she asked me, you're not just being too hard on yourself. Look at your clean, beautifully dressed baby. You're dressed and clean.
Outwardly, things appeared normal, but in reality, Gemma was becoming extremely unwell.
It is hell, because to a certain extent, you don't give a monkeys about anything, but it's not in a carefree way. I didn't care to eat, I didn't shower, but at the same time, I was worried about everything. And then I started having thoughts of dying popping into my head.
Aware that something was very wrong, Gemma contacted the community mental health team in her area.
If you do have concerns about your mental health, or you notice any changes, or you've got a pre-existing condition, the first step would be to share that with professionals involved in your care. So that can be a midwife, it can be a GP, it can be a health visitor. And I think it's also important to be mindful that you do have a choice, so you can ask to be referred into a perinatal service if there is one, or to a mental health specialist.
Though services can vary in different parts of the country, there will be support you can access, so it's important to ask your midwife, health visitor or doctor what's available. In Gemma's case, a community nurse referred her to a psychiatrist for an assessment.
Community perinatal mental health teams are invaluable resources. They can give guidance around things like prescribing in breastfeeding or in pregnancy, helping our colleagues in adult community services think about how risk might be assessed or measured, and also holding very much in mind the impact of mental illness on the mother, the child and the family.
The CPN had me assessed by a psychiatrist and came round, talked to me, talked to Ben separately. And the psychiatrist had asked me a number of times, have I had suicidal thoughts? Have I made any plans? Have I had any thoughts of hurting Molly? And I would say, no, no, no. They left, these three people, and then 20 minutes later they came back down the path. And I thought, he knows I was lying. I suppose there was still something in me that thought I better not tell them what's going through my mind, because they might take her away from us.
Like Gemma, many mothers experiencing mental health problems are afraid that someone will take their baby away from them, but this is extremely rare. In fact, Gemma was referred to a mother and baby unit, or MBU, a specialist unit within a hospital where mothers with severe mental health problems can receive treatment and support while their baby remains with them.
What I would say to a mum who was afraid that her baby would be taken away from her is, we know that mothers recover well and they recover much quickly if they are with their babies. So the mother and baby unit is just that. It's a specialist unit, inpatient hospital that provides space for mums and their babies together. So there would be no separation.
It was a good thing I was kept safe for the 10 weeks that I was in the mother and baby unit. In the mother and baby unit, initially that first weekend they just want you to settle in, they just want you to rest and they take care of the babies. You're assigned a key nurse yourself and your baby gets a key childcare practitioner. You're not forced to do the baby's care.
You can find out more about mother and baby units and the care you might receive there in another film in the Out of the Blue series about mother and baby units. And if there isn't a mother and baby unit in your area, your doctor can help you find the right support, whether that's in the community or a stay in hospital.
So if you haven't got a local MBU to where you live, my advice is to still share your concerns about your mental health with a professional, so that might be your GP, who can then refer you to an adult community mental health team for a fuller assessment. If it's possible and you have got community perinatal services, they can signpost you on.
The advice would be to seek help from health professionals specialised in that area. So it would be to seek support from the GP, who would then need to be making sure that a specialist psychiatrist from a perinatal mental health service or just a psychiatric service would be able to see the mother and do a full assessment and make sure that mother was able to be admitted or taken into a hospital unit close by. In those instances, you may find if it's going to be an adult mental health ward, then there may be a short chance that mother and baby might be separated for that period. But what families should bear in mind is that the sooner the mother gets access to specialist treatment, the sooner she's likely to become well and reunited with her baby.
Whether or not you have an inpatient stay in hospital, recovering from severe mental illness is a journey that takes time and perseverance and may involve medical treatment. Like many women, Gemma and Katie's route to recovery involved taking antidepressant medication.
So I went to talk to the specialist and basically talk about my options, what they were. It was worked out that I would be on antidepressants at home under the care of my family, so that's what I've done.
Medication plays quite a significant and very important part in the treatment of severe mental illness during pregnancy. If you've not been on any form of psychiatric medication before, there can be stigma surrounding that, but just say that mental illness is a condition like any other. So if you had a condition such as diabetes, you would make sure that you took your oral medication or you took your injection, your insulin. It's the same thing with mental illness. Make sure that you continue taking your treatment and stay well.
Being isolated is a common part of depression for many women, and both Gemma and Katie found it helpful to go to groups with other parents.
My support worker, social worker, will come round and see me every week, at least. And my friends from my antenatal group were there and invited me to various baby groups.
So the Children's Centre is a great way to kind of find support, because when you go for one group, there may be 6 other groups as well. So you could then go every other day or every day. There may be a group that suits you. Not only that, children's centres do get training courses and well-being courses that come in. So, and you can have a key worker, and the key worker can help you as well.
Gemma also had a 3-month course of cognitive behavioural therapy, or CBT, a technique that involves working to break down unhelpful patterns of thinking and behaviour and establish more positive ones.
Although I don't kind of use it now, I think just going through that 12-week process of doing the different exercises, and it's more practical stuff, and like one exercise was what's a perfect mum and what's a dreadful mum, the worst mum ever, and then like you're in the middle, you're a good enough mum.
It's also important to communicate with your family, as Katie has found.
With my eldest child, I talk to him. If mummy's crying one day, it's not because of you, it's because mummy feels a bit low. Mummy takes the tablets because she's feeling low. So just explaining everything really, age appropriately obviously, but just explaining to people and being honest. So if I did feel low, I need to be honest with people and say, I am feeling low.
No matter how desperate things seem, if you're suffering from severe mental health problems, with the right support, it is possible to recover and care for your baby.
I will never like what happened, but then I think I've come to terms with it and accepted it. You have to move on. You have to deal with it at some point and say, I'm not going to keep on, revisiting and saying, what if, because what if it isn't going to happen. So you just enjoy what you have now.
Life now, so for the last 2 years, and Molly's 3.5, is better than I could ever have imagined, even if I hadn't been ill. And I think that illness is why life is so good now.
The difference is fantastic when you actually can smile and not pretend to smile. You actually feel happy and you feel confident, and when you're walking in the street and someone looks at you, they think, oh my God, I'm hiding. You then look up, you feel proud of yourself, of what you've accomplished. And I think it was a big difference. It was so rewarding to be able to know that I'd come through this issue and problem and I'm still standing.
You can find more information, support and telephone numbers for helplines you can call on the websites listed on your screen now.